Welcome to Invest Insights. I'm Abby Maloney. I'm joined today by Doug Bartel, the market leader of Florida Blue. Doug, welcome.
Hey, welcome. It's so good to see you again. I wish it was in person like we've met before.
I know, I really wish it was in person, but hopefully, yeah, and we'll be talking about vaccination soon. Hopefully, as
Mhm.
soon as we have herd mentality with vaccination, it will be in person.
Exactly.
Well, stemming from all these challenges in 2020, how has Florida Blue approach or process transformed regarding the way that the company provides coverage and services to its members?
Well, I'd have to say that what our nation, what our state, what our company, employees, and our communities have gone through really over the past year or so is unlike anything we've ever seen before. And it has challenged us and it has tested us. I know you're talking about transformation. I don't think that it has transformed who we are as a company. It's always been in the DNA of Florida Blue as a mission-driven company for us to drive access and affordability of healthcare and to make a positive impact. So yes, we've been pushed, we've been tested, we have transformed how we do things for sure. But it's really been about us continuing to live out our mission and our core values just in some new and different ways. I don't know if you know this or if everyone knows this, but we view ourselves as a health solutions company and not just a health insurance company. So solutions, not insurance. So I like to say that selling health insurance policies is a transaction. And we're in the business of taking care of people. That's not a transaction. These are people's lives. These are our members. These are Floridians. So we get to know our members. We get to know the communities. We understand that no two communities are the same. And then we try and help people and communities achieve their unique and individual health goals. So you want to talk a little bit about COVID, and I think we've done a lot in terms of transforming, with more than $200 million in COVID support across the state. So for our members, individuals, those with health employer plans, Medicare plans, since the start, they've been able to get COVID vaccines at no cost, no cost for testing and treatment, so no copays or deductibles. Something we started as a response to the emergency, and then we integrated into our benefits for 2021 for this year. No cost telehealth, so that popular virtual health, I know you want to talk about that a little bit more. And we added the ability for people to earn up to $500 in rewards. So putting money back in people's pockets for doing simple health and wellness things. And then those reward dollars can be used to lower their bills or pay things like copays or deductibles. So people can also see the doctor for no cost. We have a group of value choice providers. So I think a lot of your listeners and viewers know that we have Sanitas, more than 35 locations across the state of Florida, more than 20 in South Florida. People can go and see their primary care doctor for nothing. And then I know you want to talk about, connecting people to insurance. So this whole open enrollment period, we have normally the open enrollment at the end of the year. And depending on when this interview exactly airs, there's now a special enrollment period open for 90 days. So from February 15th to May 15th. Once the new president took office, he opened up this enrollment period. And anyone who maybe was busy during the holidays, distracted, or something has changed in their life, has the opportunity to go out and purchase insurance. So we have transformed in a lot of ways, but again, I'm going to play with that word and say we haven't transformed in terms of who we are. We've just been tested in new and different ways. So we are really passionate about getting Florida covered. That is a campaign of ours to get people covered with healthcare and health insurance and to get people vaccinated, which I know you want to talk about more.
Yeah, and actually, I wanted to jump into the vaccination, and you touched upon it a little bit just now, that Florida Blue has provided more than $200 million in COVID-19 support to the state of Florida by waiving cost sharing for COVID-19 testing and treatment. And in December, you announced that Florida Blue would be covering the cost of COVID-19 vaccines to its members.
Yep.
And with vaccines on everyone's mind, what is the role of insurers like Florida Blue in this vaccination process and making it more accessible to the community at large?
So I'm going to go back to something I said at the beginning, when we're a health solutions company, but we're a healthcare leader, not just a health insurance leader. So we have been out in front from the start when it came to asking people to mask and social distancing, excuse me. We sent back or dispatched our entire workforce home last March for health and safety reasons under the guidance of federal government. And then specifically on the vaccine front, we're working closely with the state and federal and local officials to support vaccination. So, at the appropriate time during this sort of phased distribution. So science has been our guide, our North Star from the start, and it continues to be. So the FDA currently has issued emergency use authorization for a couple of different vaccines. We have two. In fact, I think we're about to have a third one that's coming soon. That's sort of breaking news. So we are in the business of strongly encouraging all Floridians who are eligible to get the vaccine when it is available to them. If folks have recovered from COVID-19, according to health experts, you should get vaccinated. So check with your doctor. It can prevent reinfection. And then we're working with a lot of community-based organizations to educate the uninsured, the underserved. There is misinformation. The truth is there's misinformation, there's trust, there's concerns out there. So on our website, through campaigns and working with community partners, we want to make people more comfortable with this idea, dispel any myths, and help just be that compassionate, understanding healthcare leader. And then as vaccines ramp up in the coming months, we're going to work with medical providers, doctors, nurses, hospitals, community organizations, and nonprofits. You talked about the $200 million in support. We supported organizations at the beginning that were giving out, food because that was such an issue and it still remains. We're reaching out to a lot of those partners and others to say, how can we help with your constituents so they understand the importance of getting vaccinated? So it's reaching out with our hearts, with our arms, and sometimes, providing financial support to nonprofit organizations.
You also spoke about the open enrollment, the special open enrollment from February 15th to May 15th that President Biden has opened for the beginning portion of this year. What is the significance of that for Florida Blue?
Well, the significance is we are concerned and always are concerned about the number of people in the state of Florida who are uninsured or underinsured. So normally there is a time, look, if you get married, get divorced, move across county lines, that would normally qualify you for that special enrollment period. What this is it is open to everyone for the next 90 days. Without talking politics too much, we were in the throes of the normal enrollment period in the middle of a busy election where there was a lot of noise on TV and those kinds of things. In addition, it was the holidays. Maybe someone didn't have the opportunity to enroll, missed it in the middle of all that noise. The other thing is that the majority of people who are listening right now probably qualify for some kind of subsidy, some financial assistance paying with their monthly premium. And a lot of people actually could get really, really strong benefits at no cost because maybe they lost their job or had a reduced income as it relates to COVID-19. So we see this as an opportunity to get to those people who maybe were busy or distracted around the holidays, to help people understand healthcare has never been more important. COVID has taught us that, the importance of our own health, and to help people understand if you missed the opportunity or if you aren't sure if you qualify for a subsidy or for help. Now is the time. Reach out to a trusted advisor, whether that's an agent, Florida Blue, online, in person, over the phone. A lot of people are working from home and doing virtual visits right now, but that's the significance is let's get more people access to healthcare so that they are taking care of themselves and taking care of each other.
Obviously, last year, technology played a huge role in transforming every sector of the economy. Mm-hmm. What role does data-driven technology play in tailoring people's healthcare needs after your experience of 2020?
So I guess I would start by thinking, how technology really has transformed so many things in the last year. People who never tried online shopping or online grocery delivery, or employees who never thought they would be remote working, or you and I never thought we'd be doing this over technology or a video chat. So even when we get past the pandemic, some things are forever changed. We may not be driving an hour in traffic across South Florida for a 15-minute meeting that can be done via video. So your point was about technology and healthcare. I want to talk about virtual health, which some people call telehealth. You'll often hear me and many others at Florida Blue say it's important to get the right medical care at the right time in the right setting. So there are times when I may need, or you may need, to go to the ER. There's a time when you might need to go to urgent care or the primary doctor. And there's a time and a place for virtual health. And I believe, and we believe, that virtual health is here to stay. It's about improving access, decreasing costs. If you've got a grandmother or somebody or someone with a physical challenge, it could take all day to get them to the doctor for a checkup that could be done remotely. Maybe that makes sense to do that visit over telehealth. Again, maybe it is someone needs to go see the doctor. So we have always planned to expand virtual health, and we have expanded virtual health benefits, meaning people can access virtual health more so now at either discounted or no cost rates. One of the things we have also seen is a lot of isolation, a lot of depression, a lot of mental health, a lot of stress, a lot of anxiety. People have missed their family, their birthdays, their graduations and weddings. I believe, and we believe, that there's a tremendous opportunity with virtual health as it relates to mental and behavioral health. Some people are really more comfortable talking to someone in this kind of format over video chat or telephone. So that's a place where we see a lot of upside for virtual health. So we have expanded access for our members to be able to do virtual health. And I think as an industry, not just to get to people who are in rural communities, but even in busy and crowded South Florida, virtual health is here to stay. And so we are using also data to look at people who may have chronic conditions and target them and saying, if you are diabetic or pre-diabetic, or if you have had a series of hospitalizations, how can we use data and analytics and then marry care? Can we dispatch someone to your home to help take care of something? If we have a senior who has fallen 3 times in the year, maybe that person just needs someone to come into their house and take a look at the way the area rugs are and lift those area rugs. I know that sounds simple, but we can use data and analytics to track that kind of thing.
And after all the changes and challenges of last year, how have you personally transformed?
I guess I will go back again to where I started and use that word transforming. I think I've adapted more than transforming. I'd like to believe that I'm the same kind of leader, husband and father, and colleague and friend and employee. I will say that some days I look at my calendar and it's video call after video call after conference call. But overall, the pandemic has taken me or caused me to take a look at what's important. I used to be, and still sometimes I am, running, even on the weekends. So I've tried to take a breath, relax, step away from the computer, put down the phone, go for a walk, be with my family. And I found that I have more time to be more focused on work when it's that time. So I'm also more focused on taking care of myself, my physical health and my mental health. That allows me to be there for others. Look, when you fly, they always say, put the oxygen mask on yourself first before you help others. So I'm trying to put my own oxygen mask on so that I can be a better healthcare leader and a better, husband and father. So I'd like to believe I have always been collaborative and innovative and, all that kind of stuff. But I'm trying to be present, even if it's not physically. Reach out, call someone, send them an email to stay connected. And then I'll just bring it right back to Florida Blue. I know that everybody or a lot of people love where they work. It's been more than a year since I've seen a lot of my colleagues, most of my colleagues. And what Florida Blue has demonstrated as a company, that we can be there for employees even when we don't see them, be there for communities, be there for our members. I'm just really proud to be Blue. So I think I've adapted more than transformed. And I think Florida Blue has lived out our mission that was there long before this COVID. And we're to continue to support Florida, not just our members, but our employees and communities.
Well, wonderful. Well, thank you again. That was Doug Bartel, the market leader of Florida Blue. My name is Abby Maloney, and you've been watching Invest Insights. Doug, thank you again.
And thank you. Be safe, everyone.
Hey, everyone. Don't forget to like this video and subscribe to our channel so that you can stay up to date on the latest business trends from our knowledgeable experts. Be sure to check out the description below for more information on the segment you just watched. Thanks for tuning in.